Back, the number of new COVID-19 cases, deaths and hospitalizations is declining. The Health Minister Joe Phaahla says they've seen a decrease of about 27% in new cases in the past week. Gauteng is said to have officially exited the fourth wave. For more on this, I'm joined now by eNCA's Heidi Giokos, who has an update. So Heidi, the first Department of Health briefing for 2022, and it seems it's good news in as far as the fourth wave is concerned.
Yes, certainly. I think everybody was very concerned when Omicron was announced, and we heard how highly transmissible this variant is. But it seems as though there is some good news. For example, Gauteng has officially exited the fourth wave, so infection rates might not be low compared to what the Department of Health wants it to be like. But the good news is that in terms of hospitalization and death, we are seeing a very low number compared, for example, to the second and the third wave. Previously, we had the need for oxygen and ventilators, especially with the third wave, which was known as the Delta wave. There was a desperate need for oxygen and ventilators, but this time around it seems as though that is not the case. So you might have a high infection rate and reinfection of those who had been infected with previous variants, but when it comes to the severity of this variant, it seems as though it's a lot milder. And to us, it is something that we have been hearing over the last couple of weeks, to say that Omicron's a lot milder, but I think the data that's coming out even more now to show that hospitalization and death is not as serious as expected. And mostly when it is hospitalization in an individual, it's the unvaccinated. But let's listen to some of those percentages that have declined over the past couple of weeks.
In South Africa, in the first week of 2022, we have seen a 13.9, almost 14% reduction in the number of new cases. In this first week of January, there were 46,680 cases compared to the last week of 2021, where we had 54,191 new cases. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal and then Gauteng. All other provinces accounted for only 11% of new cases. There has been a 4.8, almost a 5% reduction in reported deaths over the last 7 days. As of yesterday, the 13th of January, there has been a 27% reduction in new cases compared to 7 days before on a national scale, and the reduction was in all provinces in terms of new cases.
Of course, Heidi, over the last year or so, it's been a case of the race between vaccines and the virus, and just basically trying to make sure that vaccine uptake keeps up as the variants kept coming over the months. What are we being told now about vaccine uptake at this point? So
it seems as though when Omicron was announced, everybody was rushing to get vaccinated because they heard how you could possibly be even more protected if you are vaccinated. So the Department of Health had some drives over the festive season at tourism spots. They had these mobile vaccination sites to say that if you are on holiday, you can still get vaccinated, and of course encouraging people to get vaccinated. But they're not seeing people coming to us to get vaccinated, and I think this is a huge concern for the departments and for governments as a whole. We do know that mandatory vaccines is a discussion that's being had at this stage, but the department's saying they cannot make any pronouncements on that at this stage because it is with the eNCA and at cabinet level, so they will have to, of course, announce when that decision is finally made. But the goal was to have 70% of the population fully vaccinated by December. Government did not meet that target, and they're hoping that by this year they would at least have 70% fully vaccinated. Of course, you are seeing people going for their booster jabs, but the main concern is to have the younger population vaccinated, because it was that age group that seemed to be getting quite sick with the Omicron variant. But let's listen to the Health Minister on that again.
The lowest coverage is our biggest cohort, which is the 18 to 34 years of age, which is still at 31.6%. As you know, we have also opened up for boosters for the general population following the Sisonke 2 boosters for health workers. And these boosters have now been opened for the general adult population, with Pfizer third dose being available after 6 months of your second dose, and the J&J second dose being available after 2 months of your one dose of a J&J vaccine. So this is now available. People just have to check their last dates of the second dose of Pfizer and the one dose of J&J. 6 months for the one, that is the Pfizer, and 2 months for the J&J. Then you can present yourself, even if you have not received a message, to your nearest vaccination point. You'll get your booster. Our main priority then nevertheless remained the full vaccination of all adults, at least up to 70% coverage.
So initial indications from the private healthcare sector initially were that, among the people that were being hospitalized under the Omicron situation with the fourth wave were those people who were not vaccinated. In terms of the overall picture being presented by government now, does that picture continue to hold across the health sector?
Yes, certainly. Tulas, we do know that in recent data that the Department of Health presented this morning is that in one instant they had about over 300 hospital admissions, and all of them were unvaccinated individuals. What's also key here is that South Africa is in a very fortunate position because they have this eNCA trial, which they are able to assess, analyze and provide this data to show how these vaccines work, if they provide the necessary protection, especially for those that are vaccinated and unvaccinated, with Johnson & Johnson particularly. And you are seeing from this eNCA trial that people who were vaccinated from the very beginning, for example, the healthcare workers, have this kind of protection that's needed against severe COVID-19 and death. So yes, you can be hospitalized even if you are fully vaccinated, but the difference here is you won't be severely sick. It might just be a day or two that you're in hospital, but it's mostly the unvaccinated that seem to be in these ICU wards and have severe COVID-19 infection. So the message remains from government: if you are not vaccinated yet, you should be vaccinated, because the data speaks for itself. It protects against severe COVID-19. Yes, you can be reinfected, but the goal here is for you not to get severely sick.
All right, Heidi, thank you. And we showed your shoes, by the way.
Oh my God.